Deputy Opposition Leader, the member for Sydney.
Thank you, Mr Acting Deputy Speaker. I'm grateful that the member for Hughes is actually supporting this legislation, although if you hadn't known that, you wouldn't from listening to his speech. You had to listen very carefully and suspend judgment. He talked about how if cigarettes became cheaper, there'd be more people buying cigarettes in the black market. In fact, all of the evidence internationally shows the exact opposite is true. The countries that have lower tax regimes, that have looser laws about smoking, actually have more counterfeiting and more illegal tobacco sold in them. So the exact opposite is true, Member for Hughes. Mr Deputy Speaker, I support this legislation and, of course, the opposition supports it. It reflects our long-standing position as a Labor government in the past, a Labor opposition now, to public health and to evidence-based policy making. We know that increasing tobacco excise is one of the most effective ways of reducing smoking rates in Australia, and it is most effective when you're talking about kids taking up smoking. We're glad that the Liberal Party has decided to pursue this policy. It was very difficult before the election to tell what they were going to do. I could see the dollar signs in their eyes, but they weren't really thinking about the public health effects of this policy. And we had the now Treasurer back in 2013 when the Labor government announced this tobacco excise, saying it's going to increase the cost of living for smokers, but smokers could be pensioners, low-income people. It could be smokes and beers might be the thing that is important to them. He said further, I want to know what the impact is on lower-income people of just increasing their cost of living. Well, it is very important to think about the cost of living, particularly for people on pensions and on fixed incomes. But what we know about increasing tobacco excise are that the people who are most price sensitive are also those people who are on the lowest incomes, and the people who are most price sensitive are those who smoke a great deal. The more you smoke, the more likely you are to have your smoking behaviour affected by an increase in tobacco excise. So the people that we desperately want to help to give up smoking, and the member for Hughes quite rightly pointed out that those groups include most particularly people on low incomes who are more likely to smoke, people who've got a mental health issue, more likely to smoke. He named a number of other groups. I would add to that Indigenous Australians, who are twice as likely as non-Indigenous Australians to smoke. The people who are most likely to be smokers are also most likely to cut down their smoking or quit because of a tobacco excise increase. The thing to remember about this tobacco excise increase as well is because it's introduced over 4 years, quite deliberately designed in this way, smokers have time to quit or reduce their consumption. It would have been, if we were just interested in dollars, in fact much more effective to put up the smoking excise, tobacco excise in one go at the beginning, raise more money all the way through. We deliberately didn't do that, and the reason was by staging increases over time, we were able to telegraph to people to say there is a cost increase coming, we're going to help you give up, these are all the resources we have to help you give up, and here's an added encouragement, the price is going up in the future. Smoking rates have dropped, and we are very proud on this side of the chamber to now have the best 5-year cancer survival rates in the world and some of the lowest smoking rates in the world. Yes, there have been efforts on both sides over many years to gradually increase the prominence of graphic health warnings, for example, to introduce advertising campaigns and so on. But we have seen from 1991, when about 25% of people smoked, a drop to just under 16% in 2010. I think if you look further back, you look to the period after the Second World War, almost half of Australians smoked at one stage. And so our achievement, I think, is an achievement as a nation to be proud of. But we need to do better. We have a COAG agreement. All of the states and territories and the Commonwealth have signed up to a target of lowering smoking rates to 10% by 2018. So we cannot— here's one smoker that we're going to get to give up in the next few years, Mr Deputy Speaker. We do need to do more. And because a 16% smoking rate, daily smoking rate, means that there are still about 2.8 million Australians who smoke every day. The cost of that to the health of the smoker, I hope I'm not making you feel bad, Mr Acting Deputy Speaker, the cost to the smoker is a substantial one.
Punishment on that one.
The cost to the smoker is a substantial one in terms of health lost, as well, of course, as the money they spend on smoking. And it costs us as a community about $31.5 billion a year to look after people who are smoking, lost productivity, hospitalisation, about 750,000 hospital bed days each year attributed to tobacco-related diseases. So the impact, both the personal impact and the impact on our whole community of smoking, is very substantial. But there's very good news as well, because people who do give up see a very marked improvement in their health. The risk of a heart attack drops sharply after just 1 year. Stroke risk falls to approximately the same as in non-smokers after 2 to 5 years. Risks for cancer of the mouth, throat, esophagus and bladder are halved after 5 years, and the risk of dying from lung cancer drops by half after 10 years. So, putting it bluntly, you can have very dramatic health improvements by giving up smoking. Increasing tobacco prices is one of the most effective ways of reducing the impact of smoking-related illnesses in Australia and reducing the premature death and disability that comes from it. What we know, I mentioned earlier in response to the member for Hughes, is that people who are more likely to smoke, those in lower socioeconomic groups and range of people that he mentioned earlier, are also more likely to have their smoking behaviour affected by an increase in the tobacco excise price. And I just want to speak for a moment about Indigenous Australians, because I was very pleased that the government has maintained the commitment to closing the gap on life expectancy. But one of the most important things we can do to close the gap between Indigenous and non-Indigenous people when it comes to life expectancy is reduce smoking rates in Indigenous communities. And there's been some fantastic work done to reduce smoking rates in Indigenous communities that I'll refer to in a little while. But kids are also, I want to talk about kids for just one moment. There is no smoker, no matter how dedicated, no matter how much they claim to enjoy smoking, who says, I want my kids to grow up to be a smoker. There's no smoker who says, I want my kids to grow up to be a smoker. And I think that as policymakers, we have to bear that in mind as well. We should be working towards a smoke-free generation. We should be working towards a generation where no young person takes up smoking. And price is a big factor in that. We know that kids are very price sensitive when it comes to testing out smoking, to trying it on, seeing how they like it. Worldwide, when you look at the impact of smoking around the world, there are about 6 million people who die every year from smoking-related illnesses, including around 600,000 deaths from second-hand smoke. According to our current projections, we will lose 1 billion people this century to smoking-related deaths. 1 billion people this century. Cigarettes are in Australia the cause of about 15,500 deaths every year in this country. And I literally cannot imagine another thing that if it was causing 15,500 deaths every year, we would not, as a community, as a government, as a country, be saying, what can we do to get this tragic death toll down? We do it with car accidents. When we see the road toll creeping up, we change what we're doing. We re-emphasise a reduction in speeding. We send out more random breath testing units. We are always calibrating and renewing our efforts to prevent death and disability, and we must do the same with smoking as well. And We've seen the proof. The member for Hughes questioned whether there is any relationship between increasing prices and reducing smoking rates. We saw a 25% increase in the tobacco excise in April 2010, and even the tobacco companies admit it worked. There was about a 10% decrease in consumption of tobacco demonstrated through the importation of tobacco products. And in fact, in August 2011, in the House of Representatives Standing Committee on Health and Ageing, the head of British American Tobacco, David Crowe, stated that, and I quote, "One of the big statements that comes from this government and many governments is that pricing is one of the best means to stop access for children. We understand that the price is going up when the excise goes up, and that reduces consumption. There was a 25% increase in the excise, and we saw the volumes go down by about 10.2%. There was about a 10.2% reduction in the industry last year in Australia." So, from the words of British American Tobacco themselves, they admit that this is a way of reducing tobacco consumption that works. I want to just take a minute to acknowledge the work that the former Health Minister Nicola Roxon did in developing Australia's approach to plain packaging of tobacco products as well, because increasing prices is one part of it, advertising is one part of it, but our move towards plain packaging of tobacco products really was acknowledged around the world as world-leading, and in fact, during the time that I was implementing the plain packaging, we had an extraordinary amount of interest from around the world in the implementation of plain packaging. And the initial results from the Cancer Council of Victoria indicated that plain packaging is meeting its legislated objectives. The early results show that compared with branded pack smokers, those who were smoking from plain packs perceived their cigarettes to be lower in quality, tended to perceive their cigarettes as less satisfying than a year ago. Thirdly, were more likely to have thought about quitting at least once a day in the past week, and fourthly, rated quitting as a higher priority in their lives. Now, when I was Health Minister, I knew that because I kept getting phone calls after we introduced plain packaging from people who were really angry that I'd changed the taste of their tobacco. Of course, we did nothing to reformulate tobacco products, but the psychological impact of seeing that really ugly packaging was actually having an effect on people's desire to smoke. We also, of course, invested more than $135 million in anti-smoking social marketing programs, which particularly targeted those high-risk groups we were talking about and hard-to-reach groups like pregnant women and people with a mental illness. We had terrific phone apps, Quit for You, Quit for Two and My Quit Buddy, that were developed and released. Anyone can use them for free. We, as everybody knows, updated and expanded the graphic health warnings. We introduced comprehensive advertising restrictions, including from the 6th of September 2012 a ban on internet advertising. We put nicotine replacement therapies on the pharmaceutical benefit scheme and extended the listings for smoking cessation support drugs like Zyban and Champix. We focused a great deal on Indigenous Australians and their smoking rates, including with the $15 million Indigenous Tobacco Control Initiative, which funded innovative tobacco control projects in 18 Indigenous communities, and the $100 million Tackling Smoking and the $35 million Healthy Lifestyle measures under Closing the Gap. They were not one thing we did, a suite of things we did, and we need to, as I said, think again in the future about how we will keep our measures up to date. People get tired of looking at they become immune to one set of warnings. They become immune to one set of advertising. So it is important that we continue to recalibrate our efforts to reduce smoking so that the effect is new with each change. It is terrific that the Liberal Party have finally been convinced to stop taking tobacco donations. I hope that the National Party will soon do the same, because it is impossible to imagine a government that is profiting from this industry will be as assiduous in their measures to reduce tobacco consumption as they should be for the benefit of the health of all Australians. I have to say, this is one of the things that I'm proudest of in my time as Health Minister. This is a measure that will lead to fewer Australians smoking. And when we consider the toll, those 15,500 lives lost every year, those 15,500 families who lose a loved one because of smoking-related illnesses. As I said earlier, Mr Acting Deputy Speaker, I cannot imagine a single other thing, if it was having this toll on our community, if it had this death toll, would be allowed to run unchecked in the way that some argue, tobacco is a legal product, it should be allowed to run unchecked.